Okay, hello everyone. It is 7 o'clock on the dot, so we'll get started here with tonight's webinar. Welcome to Alberta Lamb Producers' third ever webinar, and it was great to see some of the same people registered tonight, so we know we're doing something right. And each webinar we do, there are more new people registered, which is fantastic, so welcome to everyone tonight. I'm Robin Moore. I'm the Executive Director with Alberta Lamb Producers. And for any of you who don't know who ALP is, our mission statement is Alberta Lamb Producers is a dynamic partner in building a sustainable, thriving industry for sheep producers. Through advocacy, education, training, communication, research, and ongoing community building, ALP proudly supports every producer in our province and has since 1972. We are recording this webinar tonight, and we will make it available on our website next week. You'll be able to watch it again if you want to, or if anyone was not available to take part in this webinar live, they'll be able to watch the recording of it later. Our first webinar on nutrition with Dale Langstrom, and the second webinar with Dr. Lynn Tait on the Thin U, as well as other great educational videos, are also housed on our YouTube channel, which is Sheep Central Alberta. So please check out our YouTube channel, and we've got lots of great resources there. So this webinar is called Neonatal Management. We're lucky to have Dr. Lynn Tait with us tonight to present this topic. I'll be turning over the microphone in a few minutes. But first, let's do a little bit of housekeeping. If you're having trouble with audio, if you're able to see the screen but not hear the audio, or that if the audio is chopping in and out, there is that toll-free number that was on the first slide there. And it's also in your registration email. So when you pre-registered, you received that registration email. It's got the toll-free call-in number, so you're welcome to use that. Here's a look at our agenda. Following Dr. Tait's presentation, we're going to have some time for some questions and answers. At any time during the presentation, feel free to type in your questions, and we will make sure to get the answers for you. You don't have to wait until the very end of the presentation to ask your questions. Anytime you think of a question, type it in the box, and we will save them there. You can see the question box on the webinar control panel. That's where you type them in, they get sent to me, and all questions remain anonymous. So you type them into the question box. At the end of the presentation, I read them out loud to Dr. Tait, so it's completely anonymous. And right below the question box, you see handouts. Tonight we have 4 handouts that Dr. Tait has provided. You can click and open them, and from there you can print them, save them on your computer, whatever you'd like to do with them. So those are supplemental to tonight's webinar. So I now have the pleasure of introducing Dr. Lynn Tait. Dr. Tait graduated from the University of Saskatchewan in 1990 with both a degree in Agriculture and Veterinary Medicine. She is currently the co-owner of OC Flock Management, which since 1996 has provided small ruminant veterinary consulting services, as well as running CFIA approved and CETA certified semen and embryo production facilities. Dr. Tait has worked on international projects in a wide variety of countries and is a contract instructor at the University of Calgary College of Veterinary Medicine. Without further ado, I'll turn things over to Dr. Tait, and we'll get her presentation up here.
Hi, good evening, everyone. We'll just wait for my PowerPoint to come up. All right, so tonight we're going to talk a little bit about neonatal management, and I thought kind of long and hard about how to go about this that would make sense to producers. And so what I've decided to do is we will work through the common causes of death in neonates, and then work through how to do a postmortem on a neonatal lamb, and based on what you find as you go through the examination of the lamb, what that tells you about the cause of death, and then look at what we can do with associated management to either prevent or reduce these particular causes of death. There's only a small number of things that lambs under a week, which is what we term a neonate, can die of, and so triaging it as a producer is a very cost-effective way to help improve your management. because a lot of these are management related. Next slide, please. Okay, so by general definition, a neonatal animal is approximately 0 to 7 days. You're looking at that period right after birth. And the vast majority of death loss, not just here but across the world in the sheep industry from birth to weaning, occurs in the first 3 days of life. Certainly in the first 7 would be almost 100% of your losses. And once they get past that, sort of 3, 4, 5 days old, they typically are off and running if they've had a good start. So what we're going to look at tonight is trying to determine where that death occurs and what management factors contributed to it or can be adjusted, changed, or addressed in order to prevent this from happening further. So we do have, they're not typically considered neonatal because but you do have the true stillborns or late-term abortions. So these are actually lambs that died in the uterus prior to being born. Now, I'm dealing with it as part of neonatal, and I'll talk a little bit at the beginning about how to sort of deal with figuring out abortions or how to handle them if one occurs on your farm, because they still contribute to this loss, and certainly they're a pretty common concern for most producers. Nobody wants to see abortions, and if they do, they want to get it figured out. They don't want to have a large number. From there, we get deaths from dystocia, I call them. These are your lambing problems. Some of these can be malpositioning. Some of these may just be lambs that take a long time to be born. But death occurs as part of something happening during the actual birth process. We have failure to breathe. They're alive, they come out, they're born, but for whatever reason, they fail to actually take that first breath and go forward from there. We have failure of passive transfer or failure to get adequate colostrum. Now, often we don't see deaths in the first few days from that. Often that leads to immune issue problems a week or two down the road, but we can see that as an issue. We get starvation. You know, if you're born alive but you don't eat, you don't live very long. Hypothermia, that seems maybe a little bit out of place tonight because it's 20 degrees outside today. But even in the spring and summer, if you get rain and wind, especially in combination, lambs can actually die of hypothermia. It doesn't have to be 40 below in January. We have trauma inflicted by a variety of things, including predators and infection. And so I've put these in basically a chronological type of order, not necessarily an order of most common. Next. Okay, so I'm a huge proponent that if you have dead neonates, you need to figure out why. You can't just guess. You can't just assume that because you found it with the ewe and it wasn't there 2 hours ago that it was stillborn. It's really important to determine the cause of death because this is a key component and is really critical to either applying corrective management or changing a management procedure in order to resolve the issue and to prevent further losses. The other thing is economically, I believe that all producers need to become comfortable, if you have any size of flock at all, in doing neonatal postmortems yourself. You're not going to come up with all the answers all of the time, but to pay a veterinarian to do postmortems on a lamb that's a few hours or a few days old is a lot more than the lamb is worth, certainly at that point, especially if it's a dead lamb. And I think you can triage a lot of your problems if you learn the common things to look for. Then if you get something that doesn't fit any of the common scenarios, you've hopefully done the postmortem in a manner in which even if your veterinarian has to look at it after you've opened it, they can still glean information that their extra experience will help you with. It doesn't require a lot of equipment. Lambs are tiny. Gloves for your own protection. You can either use a sharp knife or you can use a scalpel. Some people just have the disposable ones. They're not very expensive. And even a scalpel in a newborn lamb is plenty sharp enough and strong enough to cut through the ribs where they join to the sternum. A small container, we'll talk about what you need that for when we get to doing the lung testing. And I always use a small garbage bag. If you open the bag and kind of crinkle it down on itself so it forms almost like a little plastic bowl, you can set the lamb into that. And then as you're opening it, you're not making a mess, you're not contaminating anything, and when you're done, you can just pull the sides of the bag up, tie up the bag, and you've got everything contained. You haven't made a big mess. So, pretty much everybody has these items at their disposal. You don't have to go out and buy anything fancy. If you're not comfortable cutting ribs with a scalpel or with the knife, you can definitely use like a pair of kitchen scissors like you'd use for cutting up a chicken. Okay, next. Okay, so what we're going to do first is I'm going to talk a little bit about how to deal with a suspected abortion, and then we'll go on to doing we'll go through the procedure for doing a postmortem on a neonatal lamb. And as we go through the different areas and what we find in those areas, we'll talk about what that tells us about the cause of death and then talk about how that relates back to management issues that can be addressed. I had to write a slide in about abortions, but when I was talking to Robin earlier, she said there have been calls, people are concerned about these, we're certainly seeing them. So I thought we'll do that at the beginning and then work from there. So one of the things to determine, I guess, is when you find a dead lamb, did that lamb die before it was born, or did it die in the process of or after it was born? So one of the things you're looking for is, does it seem at all rotten or decomposed? Unless you find a lamb that's 3 days old laying out in a field that you missed, anything that has any sort of decomposition to it was dead before the ewe gave birth. So that's often an indication of abortion. And there are some diseases, like chlamydia, where you can get what we call a full-term abortion. Those lambs will go right full to term. They'll be in the right appropriate window for lambing. But when they're born, they're dead. Often they're small, and sometimes you can tell they're just kind of rotten and they're starting to decompose. And often the placenta is very unhealthy looking as well. So if you get anything that doesn't look like a normal, healthy, full-term lamb, whether it's dead or alive, but has any sort of abnormality in that way, decomposition, sometimes a big one and some small ones. Often if there's multiples, they'll be very different sizes. Whenever you see that, you should have in the back of your mind, this could be an abortion. And a lot of the things that cause abortion in small ruminants are contagious. So they're important to deal with the biosecurity on, and almost all of them are also contagious to people. They're zoonotic. So you need to absolutely be wearing gloves to protect yourself. You want to minimize contamination of any surrounding area, so that particular animal that's aborted, the fetuses, everything, you want them contained. You don't want them running around in the entire group. And small children, adults, or any age of person who might be immune compromised, if they're undergoing chemotherapy or anything like that, or have immune disorders, they're on immune suppressant drugs, or pregnant or potentially pregnant women should avoid handling abortions, because those are the people who are going to be most susceptible, and most of the things that cause abortions in sheep and goats also cause abortions in humans. So middle-aged men are probably your ideal for dealing with the abortions on the farm. You don't want small children, as much as they're usually with the flock, and I think there's no issue with that. In this type of a situation, you don't want the children handling any of that or being around it, because they're more likely to get infected. So with abortions, what I recommend to people is that you can get one, and it might be what we call spontaneous. It may not be a concern. It may just be that particular ewe had a nutritional issue, a trauma, stress in goats can cause it. So what you need to do is collect up those fetuses, collect any and all of the afterbirth or the placenta that you can find, because most of the abortions are actually diagnosed from the placenta, not from the fetus. And so you collect all that up, you bag it all up together in large Ziploc bags, something that will contain it well. You label it with the U, the date, and what I recommend is then freeze it. Freezing it's not perfect for diagnostics, but it's the best way to store it. So I would recommend that you do that for the first one. If you get a second one, do that for the second one. If you get a third one, then we would go ahead and submit to the lab all 3 of those abortions. Because usually if you get 1, it could be spontaneous, maybe even 2. If you get 3, you have to start to be suspicious that you actually have a contagious organism. And so the samples from all 3 of those give you better chance of getting a diagnosis than if any one of the 3 individually. Now, for quite a few years in Alberta, we had the neonatal mortality study running with Alberta Agriculture, and so they would accept submissions of abortions, and I think lambs or kids up to approximately 10 days of age as part of that study. Now, the study itself has ended, but certainly they can still work with your local veterinarian if your veterinarian feels like they need assistance in an abortion storm or herd outbreak. The other thing is when you take a lot of the labs, we use the diagnostic lab at the vet school in Saskatoon, they're very good that if you submit 3 neonatal or aborted samples together, they deal with them as one unit. So instead of paying for 3 separate sets of postmortems lab tests, they deal with all 3 together and you get 1 set of charges. So the most bang for your buck is that triple set of samples, 1 set of fees, and hopefully a diagnostic answer that you can move forward in your flock. Often people don't keep the first couple and then all of a sudden they're into the middle of an abortion storm and they're already behind the 8 ball. So that's my recommendation of dealing with abortions. So if you're in this procedure, you feel like these were dead before they were born, then just assume and treat them like they're contagious abortion, and then isolate the female, get rid of all the bedding material where she was, that type of thing, where she had the babies born, and save the aborted fetuses and placentas. If you get to the end of your season and that 1 or 2 is all you had, then you can say, you know what, they weren't contagious, obviously, we don't have a problem with, we're not facing a big wreck, and you can dispose of them the same way you would other dead lambs, whether that's composting them, burning them, you can just dispose of them at that point. But in the meantime, you've covered yourself just in case. Okay, so going forward from that, we're going to assume that they weren't dead in the womb and they're not rotten and they're not abortions. So then we're looking for how do we determine when and how this dead lamb that we found in the pen or in the field has died, and then we can work on, once we know that, what can we do to correct the problem, minimize the problem, because often they are management issues. So one of the first things, now this outline that I'm using, this decision tool, it was actually designed for a research project in New Zealand, and one of your handout attachments, the one that's called Lamb PM article, it has the entire article that actually talks about the study they were doing in New Zealand, but this was the little chart that they produced for the farmers to be able to follow and submit the data on the things that the lambs died of, that when they were doing this research project. And it's a really good little flow chart. So what I've done is taken out the main pieces of it. You can also, if out of the handout, you can print it out. Some people will do that and they'll write the lamb ID on the top, and then they can just kind of follow through it as they go so they don't miss anything. So they have them weighing the lamb to the nearest 0.1 of a kilo. That's not really that crucial in determining death. That was really for their research. Same with the gender. It has more to do with their research. So if you skip the 1 and 2, you're not losing out on any information, other than you should probably have that for yourself anyway. So then the first thing you want to do is you want to look at this lamb for any sort of abnormalities. Sometimes lambs are dead or don't survive the birthing process because they have some sort of developmental defect that makes that impossible. So you're looking for, does the head look a normal size and shape? Are the legs all on correctly? Is the lamb the right size and shape, for its breed, for its type? Those type of things you're looking for. Is there some obvious abnormality that this lamb just wasn't meant to be alive? The other thing that you're looking at is, has the lamb walked or not? Now, for those of us who lamb in January in pretty close confinement, we typically know that because it's cold and the sheep are being very well observed. If you're lambing in a little bit more extensive situation, which from now into the summer is very likely, you might find a dead lamb and it may or may not be near the ewe, but part of deciding when it died was, did it get up and walk around and then die, or did it never get up? So it shows you the little picture there. If you look at the bottom, if you've never really paid attention, next time you get a brand newborn lamb, look at the bottom of the feet. They have like a little soft pad on them when they're first born, and when they walk on that little soft covering is gone, and then they would have what you'd expect to see, sort of a normal little lamb foot with the pad and the hoof. So a lamb that's never walked never got up. So it probably never nursed. It may well have died during the birthing process. A lamb that has got up and walked around and then died, then you're looking at a whole different management issue of, did the mom leave it behind? Did it get hypothermic? There's a lot of other issues. If that lamb was alive enough to have stood up and walked and now it's dead and it's only a few days old, we're looking at an entirely different set of management issues. Now we have to be worrying about things like mismothering or starvation, those type of things, as opposed to a lamb that never stood up, which may well have died in the birthing process, and that certainly can happen. So that's kind of one of the first key determiners, is to determine when did the death occur, before it was ever born, during birth, or after it was born, and possibly even after it was up and moving around. Okay, so moving on from there, we want to examine the actual lamb itself and the internal organs, because that's going to tell us a lot, again, about not only the timing of the death, but the cause of death. So it shows a picture here. Now, I don't advocate removing the thyroids. We do not see a lot of iodine deficiency as a clinical problem here, and I think that's sort of beyond what you need to do. It was part, again, of their research, but it shows a very good picture of the lamb laying out open. So when you go to open a newborn lamb, what you want to do is lay it on its back and kind of spread its legs out, so that keeps it stable laying on its back, and you're looking at its abdomen. And you want to make one long incision. I usually start at the navel, and I go towards the tail, and then towards the head and up underneath the chin to the symphysis, where the lower jaw joins at the center. And if you hold the skin up and make a little nick with the scalpel, you can either cut the whole length of the scalpel if you hold it up so you don't damage the internal organs, or you could use a pair of scissors if you feel more comfortable that you're not damaging anything underneath. And in the process, then you can also cut the ribs right along the edge of the sternum. In a newborn lamb, or even a 3-day-old lamb, they're very soft and they're not hard to cut through at all. Even at a few weeks of age, you can easily cut through them. So then you have your entire lamb laid open. And so methodically, what we want to do now is decide the next step of when the lamb died is, did the lamb ever breathe? Did it land on the ground and that was it? The afterbirth was over its head. Sometimes that happens. The mom doesn't get it licked off quick enough, or it doesn't break. Or did it breathe and that part was working and then something else went wrong? So on the pictures here, it shows you pictures of a very pink lung that's inflated. That's typically a lung that's had air in it. And then they show you the one that's partially inflated. It looks a little more like a liver. And that's because it's not full of air. Now, that learning to sort of see that takes a little bit of practice, But the really quick test is you go back to your supplies that you needed and you take your small container, and it can just be like a little margarine or yogurt container, put some water in the container, cut a small piece of the lung and drop it in the water. If the lung sinks to the bottom, the lamb has never breathed. There's no air in those lungs. If the lamb has breathed and there's air in the lungs, they'll float on the top of the water. So that's a really quick way to decide if this lamb ever took a breath or not. So if you get a lamb that's never breathed, then you have to think, did this lamb die in the birthing process, or did something happen? And we've all seen them where they have a placenta over top of their face. And if you're not actually right there, you've got seconds to save them. Or did this lamb breathe? It came through the birthing process, it was breathing, and then it failed to survive after that. So we'll kind of talk about them a little bit differently, but the flow chart kind of gives you if you go no, it takes you to the next phase. If you say yes, it kind of tells you where to go with those. And then also what you're looking for is there any, does the lung tissue look like normal, happy, healthy tissue, or does it start to look like it's breaking down? And again, one of those things that can be an indicator. If the tissue looks at all like it's decomposing, that lamb may have died prior to being born. Not all lambs that die prior to being born are completely rotten, but the tissues will start to decompose pretty quickly, and lung decomposes very quickly. So that's one of the indicators that we would use. Next slide, please. Okay, so once we move on now we're looking for signs of dystocia or difficult birthing being a possible cause for death. And I think, sometimes they go through more dystocia than maybe we realize. Sometimes we absolutely know that was the problem because they were very large or they were malpositioned and the head was stuck out and all swollen. Sometimes it's a really obvious thing, but sometimes not as much. So you're looking for signs of hemorrhage. And you can see in this picture, instead of nice pale pink tissues, it looks like it's bruised and bleeding. No lamb at a few days old should look bruised and bleeding anywhere. Is the liver ruptured? When you look into the abdomen, the liver looks like a liver. Most people have eaten liver or at least seen it in the store, so you kind of have an idea what you're looking for. That liver should be smooth, should be that pinky brown color. If it's got cracks in it that looks like it's been cut or it's falling apart, that's a ruptured liver, and that again can happen from trauma. Now, trauma could be during birthing, like that could be, it caused that much pressure to it. Sometimes with malpositionings, you'll see that. That could be trauma after birth if it got stepped on. Or occasionally picked up and thrown against the wall. If you have a ewe that doesn't particularly want a lamb, they can certainly cause enough trauma to kill them. So those are the things you're looking for, and then you're looking for what they call edema, which is just fluid underneath the skin. If you have fluid underneath the skin, it's often a sign of that they've been traumatized. Stepped on, squished, beaten up. Those things can all happen. And so I think often death due to dystocia, the actual, at the time it's happening, there's maybe not a lot we can do. If you get a very big lamb, it has to come out somehow. But if it's due to the fact that the ewes are not being checked regularly enough, that dystocias and malpositionings in particular are happening and you're not being able to intervene soon enough, that's easy enough to rectify with a little more time and attention to the individual animals. The other thing to look at is often lambs that have come through a difficult birthing or a delayed birthing because of things like malpositioning, they're stressed. And when they're stressed, even in the uterus, they release the meconium, which is that first sort of yellowy manure that they pass, and they come out yellow. They often have yellow staining to the hair. The fetal fluids that come out with them are often yellow. That's a sign that that fetus has been stressed at birth. And so sometimes if you find one that's dead and it's all yellow, that usually is an indicator that you've had a dystrochia problem, and yep, the ewe has managed to deliver, but not in an appropriate amount of time for the survival of the lamb. Okay, so then as we move into the abdomen and looking for, do we have, and they conclude starvation, mismothering, and exposure. So starvation and hypothermia all kind of go together, and typically starvation often is a mismothering issue. It's not that the ewes don't have the milk, but often the lambs, for whatever reason, are not actually getting fed. So one of the things then we're looking for is that lambs are born with something called brown fat. So you look around the heart in the chest cavity and around the kidneys, which are attached up at the spine. So when you're looking down on this opened lamb, they're going to be at the bottom underneath the intestines. There's kidneys, and they're right at the body wall. They're almost buried into the body wall, and there should be, it's a brown fat. It's not a white fat like you could expect to see on a finished slaughter animal. It's kind of a light tan, almost a taupey color. They're born with that fat, and until they get some food into their system and start metabolizing for energy, they burn that fat to stay alive. So if you have an animal that's dead and has lots of brown fat, then it didn't starve to death. And it's probably not hypothermic. Then you might be looking at the fact that this is an animal that died from some other cause, like trauma, dystocia, those types of things. If you get a chance, if you open ones that have never breathed, they should have brown fat because they haven't been alive to metabolize it, and it'll give you a chance to see what brown fat looks like and how much they should have. So if their brown fat is gone, then you have to be concerned. Well, if they've used up all their brown fat, they could be cold and or starving, and those two things often will go together. So then also you want to look in the stomach. Is there milk or a milk clot, a milk curd in the stomach? If the stomach is completely empty and only has some mucus in it, then that lamb has not nursed. And so then starvation goes up your list quite a bit. And then you look at the management issues related to starvation. Is it that the ewe didn't bond with the lamb properly? Is it that the lamb was too weak to get up and nurse properly because of dystocia? Or maybe it's cold and wet and the wind is blowing and it got chilled right from birth because the lambs are wet. And if they're wet and they're cold, that's a bad combination. And then also looking to see if there's evidence that milk has actually made it as far as the intestines and started to absorb. So those are all indicators of, have they used up the fat stores they were born with, and are they getting now an outside food supply, both of which are pretty critical. Lambs are pretty tough in general, and if you can get them dry and you can get food into them, then those lambs typically survive quite well. If they start to get hungry, then they're going to get cold, or if it's particularly cold and or wet out, they may not get up and go nurse. They may huddle in a corner somewhere to try and stay out of the cold, and then they don't get food into their system, they use up their fat stores, and they start to develop hypothermia. One of the handouts is called Intraperitoneal dextrose, and it actually walks you through giving basically a dextrose or a sugar solution directly into the abdomen of a lamb. So if a lamb is hypothermic and not dead, they certainly can be bad enough to be comatose. If you tube those lambs, they're not absorbing it because their gut's not working at that point because they're so cold, and the chances of aspiration pneumonia are quite high because of their comatose state. It may not stay down in their stomach, it may come back up, and then they may end up aspirating. But if you warm those lambs up without a source of sugar, the brain needs sugar. That's what the brain needs to function. And if you warm them up and they have no sugar source, as soon as they start to warm up, they start to seizure and then they die because their brain has no food. And so giving the intraperitoneal dextrose gives them that sugar solution that they need, It's also warm, and you're putting it in the abdomen, so it helps warm them literally from the inside out. And that's pretty key. So it talks about how to decide whether or not they need it based on age, and how to mix it up and how to give it. So that's a good thing to learn how to do. And like I say, cold, wet, rainy weather means you can still see hypothermia even this time of year. It doesn't have to be winter. Okay, next. Okay, so far we've covered a lot of the normal things that we see that cause deaths in lambs. Then lower down my list is we do worry about infections, in particularly naval infections. So you need to look at the navel area. Does it look swollen? Does it look discolored? Any of those type of things. Now this is not going to be a lamb that you find that was born an hour ago. These are going to be your 3 to 7 day old lambs, because even bacteria generally takes 2 to 3 days to actually get into the body and multiply to enough numbers to actually cause disease. So if you see a lamb that's an hour old that you think has infection, chances are you're actually looking at an abortion. It got infected in the uterus, because an infection just can't take hold in a newborn that quickly. The other thing to look at is, when you're looking at the abdominal contents, is look at the liver. If you see spots on the liver, or the liver looks really discolored, those types of things, that often can also be an indication of an infection. And so, although, like I say, less common, often with navel infections, I typically don't see lambs that are dead. When I see navel infections, what I see is lambs that are a week or two old often and suddenly get swollen joints. It may kill them eventually, but it's not usually something we see in that first week, but it's always something to keep in mind. You know, you do occasionally get lambs that are born in less than hygienic environments, you know, or they decide to go have them by the side of the slough. And so they certainly could be exposed to bacteria that could make them ill in a very short period of time. The other thing when you're looking in the internal part of the lamb is, are there any obvious abnormalities that might have killed this lamb? One of the ones that I think most commonly comes to mind that we'll see in a lamb that's maybe 2 or 3 days old is they start to look kind of bloated. And if you ask, or at least if I ask the producer, have you ever seen them pass any manure? And often they haven't. And sometimes it is because the meconium can get very dry. And until they can get that dry plug of meconium out, everything else can't move through. But sometimes it's because they have no anal opening. So always check that under the tail. If there's no anal opening, there's nowhere for the feces to go. So everything starts to back up. The other thing is, sometimes there'll be an opening, but the last part of the colon is not formed properly. You can sometimes see this on postmortem. You'll follow the intestines along, and they look pretty normal, and they're wide enough you can imagine food going through them and fecal pellets. And then all of a sudden, close to the rectal opening, it'll get really thin. It'll just look like string. And so again, because there's an incomplete colon, once food passes through and feces start to build up, it's got nowhere to go. If you have a live lamb that you're trying to determine that on, if you take a rectal thermometer and slide it in gently, often you can't put it in very far. It hits like a wall. And that often, and those lambs, I mean, they start to look bloated literally because they're filling up and there's nowhere for the fecal material to go. So look for those type of abnormalities. The other place we sometimes see abnormalities is in chest shape. Sometimes the ribs will be, instead of bowing outward, they'll bow inward. You know, there are some of those things where if you look at something you think, man, that just doesn't look normal. Often that can be a cause of death because they're just not put together correctly to survive. And I guess I like to highlight on number 16 here, because it says, is the cause of death unknown? There are times when you'll go through all of this and everything will seem like it was functioning and it was working, and you come out at the end and think, but it's still dead, and I'm still not sure why it's dead. So I think those are the ones that maybe then you give your veterinarian a call and say, you know, I had this lamb and I opened it up and I followed the procedure, and I'm not finding anything that jumps out at me that says this is why this lamb is dead, and get them to take a look at it. Because there are some sort of extended testing we can do. We can open the skull, look at the brain. You know, sometimes it's a septicemia. There may have been bacteria got in through the navel, didn't cause any particular swelling or lesions of the navel, but it spread through the whole body so fast that the septicemia killed the lamb in a very short time without them even really looking ill. And those aren't the things you're necessarily going to be able to see as an obvious diagnosis. So don't feel like you have to get all of them all of the time. But if you can get a good portion of them, you can figure out where your issue lies. So then I guess what I'd like to do now is just kind of look at the big causes of death, and then look at the management that's associated with that, so that you kind of have an idea of how to manage what you're finding. Now, we already talked about abortions and kind of what to do about abortions. If you have dystochias, I guess sometimes there's nothing you can do about those. They are what they are, and you have to do your best to get the lambs extracted, and sometimes the lamb doesn't make it through the procedure, or sometimes by the time you get the first lamb corrected, either in position or in size, you get them out, the other lambs behind it may or may not survive the wait because they're prepared to be born and it's not happening. One of the things that will help is use lube, and lots of lube. You would be amazed what you could accomplish when something is really greasy, as opposed to when the lamb is starting to get dry, it doesn't have a lot of fetal fluid around it. That's going to make it harder to extract it regardless of the circumstances. So lots of lube for your arms going in, lots of lube for the lambs coming out. I've gone to lambings where a lamb's partway out and that lamb may be dead and it's all dry and they're just like, there's no way we can't get this out. And I will actually take lubricant, put it in 60 cc syringes and put a feeding tube on the end and slide it in there and literally fill the area around the lamb with lube. And once you get them that greasy, you would be amazed what will come out of there. I do very, very few cesareans in sheep because 99% of the time we don't need to. So don't be afraid to use lots of lube. You can buy J-Lube. It's a powder. You just dump it into water and it turns to slime. So it's very handy for storing it when you're not using it because the powder doesn't care if you freeze it or anything like that. There's all kinds of just general lubes available that we use for ultrasounding, for palpating. They're not hard come by, and I think everybody should have some. If you're really in a bind, mineral oil will work, but a water-based lubricant is nice because it washes off, and we know that it's not irritating for the ewe. I guess the other thing is, checking frequently definitely helps eliminate the dystochias that happen because there's a malposition or a large birth and the ewe's not struggling over an extended period, where then you're extracting a dead lamb, because if you'd gotten to it sooner, you wouldn't have a dead lamb. So dystochias kind of fall into that category. Some of these, if you've had a dystochia, if you have lambs that are born that have had a little bit of a rough time being born and maybe a little bruised and beaten up, often we'll treat those with a mild anti-inflammatory like Metacam, that you can talk to your local veterinarian about having some on hand. It makes those lambs, it's kind of like us taking Tylenol, it makes them not so sore and not feel so beat up. They're more likely to get up and nurse and move forward and not just lay around feeling bad. So there's certainly, some things we can do to kind of help make that a little bit easier for them, even if we couldn't change the actual birthing process. Where I'd like to probably focus for the next 10 or 15 minutes is talking about the whole hypothermia, starvation, mismothering thing. Because I think there's a lot of times where these are missed, or they're assumed they're stillborn and they're not, and this is probably the one area of management where I think you can do the most to help both the ewes, the lambs, and your bottom line by not losing as many lambs. So some of the places where we're going to see this obviously is inclement weather. Hypothermia can set in really quickly. Lambs, if it's really cold and they don't get dry and they don't get fed, in a matter of hours, they can be too hypothermic to progress. You're going to end up with those ones that are really weak, that they have no suck reflex. By the time you start to, if you stick your finger in their mouth or a thermometer and they're actually clinically hypothermic, they don't have any real reserve left. They've used up whatever they had to stay alive. So on those ones, I think you have to always consider the inclement weather. If you're lambing it when it's cold, people are pretty diligent, but sometimes we get lulled into thinking, well, it's spring or it's May, it's June, the weather's really pretty nice, and we forget, one, that it still gets cold at night. So lambs born at night or early in the morning could get a little bit chilled if they don't get up and eat right away. And also that woolly lambs, if you look at a newborn woolly lamb, they're not completely covered in wool. They have little wool ringlets with pink exposed skin everywhere. A hair sheep or a goat actually has a better body coverage as far as keeping them warm when they're newborns than a woolly lamb does. And so if you get any sort of wind on that wet wool with that exposed skin, they're going to get chilled really, really quickly. So I'm a firm believer that if inclement weather is involved at all, and if you're not certain, I would rather see people tube feed a dose of artificial colostrum into those lambs just to make sure they've got something warm and some food in their bellies, and then give them time. Drying them off. You want good bonding, so you want them to smell right. You want them to mom to lick them a bit. But if she's bonding to them, but they're seeming really cold and frosty, there's nothing wrong with toweling them down or taking a bit of a hairdryer and drying them off to give them a fighting chance to not get hypothermic. Let them get some food into their system and get going. So I think it's a labor thing. It's not rocket science. It's all just being committed to the survival of those newborns in bad weather. The other big place that I see losses due to starvation are due to mismothering, and that sometimes is a management issue, sometimes that's a selection issue. So extensive lambing that is occurring on pastures, mismothering is more likely probably to happen than in confinement where they're put into claiming pens. And certainly big extensive operations in a lot of the world accept a certain amount of death loss due to mismothering, and a lot of them don't necessarily have high lambing percentages. If you go to a place like Chile, they're quite happy for those ewes to have one lamb because they can focus on one lamb, take care of one lamb, keep track of one lamb. As soon as they have two lambs, their lamb losses go up quite a bit because on their huge extensive range, they haven't genetically selected for higher prolificacy, and the moms just often lose track of one of the lambs. So in this country, where sort of regardless of your management, you really kind of need two lambs in order to pay the bills and make some money, even in a more extensive grass-based lambing, I still think it's important to have the ewes that are not lambing or are waiting to lamb. It's nice if you can have them separate to the ones that have already lambed, because then you're not going to have ewes that haven't lambed yet trying to steal the babies of ewes that have, because they're close to lambing. The hormones think they should have a lamb, but they haven't given birth yet. They're either going to steal lambs that then the original mother's not necessarily going to want them back, or they're not going to want their own lambs because they already have this lamb, so then they don't understand when they give birth, well, I don't want this one, I already have one. So if you can keep the pre-lambing and the post-lambing groups separated, even in an extensive area, that is going to help with that mismothering situation quite a lot. And typically mismothered lambs just starve. Like there's nobody out there looking after them and feeding them, and everybody they go to bunts them away. And if you get that situation, if you pay close attention to those lambs, those are the lambs you need to pull them and feed them. They're the ones that are going to be dead at 4 days of age because they can only live so long even when the weather's nice before they run out of fat to work off of. The other thing is, confinement for short periods of time. Even in a pasture type situation, I've seen people that lamb in a pasture situation and all they do is put up some little panel pens in the middle of the pasture area, and then they just put the lambs into those for a little bit, maybe 12, 24 hours, depending on the numbers and the mothering ability of the ewes. Just gives them that chance to bond up, and then they get them tagged and let them back out again. So, again, it comes down to it adds more labor, but it's the extra labor that saves the lambs. So, in this particular instance, it depends a lot what sort of losses you're prepared to accept. The other thing we will sometimes see is in a more extensive situation, and sometimes even in confinement, you get either ewe lambs or a little bit older ewes that maybe don't have as much milk production as they need to, say, raise a set of twins or raise a set of triplets. And if you're not paying close attention, one of those lambs is going to start to fall behind. Now, some people have a philosophy that if they have triplets, they just automatically pull one of them and feed it and be done with it and leave the ewe with two. Some people will give them 24 hours and kind of see which one maybe is smaller or doesn't seem like it's getting quite as much to eat as the other two, and then they'll pull that one, saying that it's easier to convince a lamb to go on the bottle if it's already hungry. So it really doesn't matter sort of which philosophy of that you take, as long as you're really paying attention to them in that first couple days and you're prepared to step in and intervene for the benefit of the lamb. Some people are very successful at cross-fostering. Other people's philosophy is cross-fostering is a headache. Not all ewes are very tolerant of it, and so it's just easier to have some bottle babies. There's no right or wrong philosophy to that. I think the important thing is you can completely avoid starve-outs if your management is really paying attention to how the ewes, the bonding, the lambs, and the actual amount of food that's available. Another one of your handouts is called Lambing Protocols 2014. And so it's just as current today. I just hadn't changed the year on it. One of those lambing protocols talks about, with my clients, unless they specifically are raising a breed where they're used to raising prolific numbers, is that anything that's a triplet, I recommend they automatically give every one of the three 1 dose of artificial colostrum. And it says Head Start in there. You can use the Grober. It's all made by the same company. It's the same product. It's just Head Start is what I have always used. So by giving each lamb 1 dose of colostrum, then they can be with the mom, and if you start to see one of them falling behind a little bit, you think, okay, I have to pull that one and feed it, or I need to leave it with the mom, but I need to supplement it. It still had quality colostrum. Because I put in the original list failure of passive transfer, which is the failure to absorb enough antibodies from the colostrum. Well, if they don't get colostrum, they won't get that antibody hit. And when you have something like triplets, or some people in the case of quads or quints, if you raise Romanovs, if you have a very prolific breed like that, the amount of colostrum that ewe has is just being divided by more babies. And so even if they all get some, do they all get enough to really get that quality and quantity of colostrum that they need for the long term of their health? So I really like, if in doubt, tube feed a single dose even of colostrum, even if they're staying with the mom. I think that goes a long way, both to saving them from disease later on because they don't have enough immunity, and also to saving your starve outs, because you're going to put some good quality food in their stomach right away, and that buys them some time to get onto the ewe and get nursing, or for you to decide maybe who might end up being the bottle baby. So I think that's a really key thing, and in the lambing protocols it talks about, sort of how I decide. The other thing you'll see in the lambing protocols that's a little bit out of place for this talk is it talks about using Baycox to prevent coccidiosis. Lambs that are 3 days old are not going to die from coccidia. If you have a lamb with serious scours at 3 days of age, it's either what they call overeating from high milk production, or it's a bacteria. Coccidia requires a longer incubation period than that, of almost 3 weeks, before it actually shows up as a clinical disease. But the reason it's on there is because a lot of producers are using the Baycox as a preventative when they're only a day or two old, to prevent coccidia for that first month of life. So that's why it's on there, but don't expect to see clinical coccidia as a cause of death in something that's only a few days old, because it's just, the disease doesn't work that way. And I did, quite a number of years ago, I actually had a producer who had no idea why he was losing as many lambs as he was, and I talked to him a little bit on the phone and said, well, like, are you using claiming pens? Are they mothering? Oh, yeah, that's fine, that's fine. And when we actually started doing postmortems on the lambs, they were starving out. Like, he had a huge mismothering problem. He just didn't recognize it for what it was. He was quite sure they were dying of some sort of infection or something like that. But I've certainly found over the years in my experience that a lot more neonates die from mismanagement than they do from actual disease. So, always kind of keep that key in your mind. Next slide. So here's sort of my take home from all of this, is do not assume when you punch into your Zion or write in your little book that this lamb was dead, do not assume without further investigation that you are actually correct in why it died. Information about death is absolutely key to making successful management decisions or correcting issues. I think that information should always be documented because it's easy to think it in your head or whatever and then you forget. One of the things I recommend doing, especially in the bigger flocks that I deal with, if you have ewes that are not providing sufficient food for multiple lambs, unless you're on a good electronic system, and even if you are, I have clients, I say to them, get a red ear tag or some color you don't normally use, don't put any numbers or anything on it, and put that in that ewe's ear right then and there in the jugs, or whenever you find the issue. Because guaranteed, those lambs will get weaned, those ewes will be there in the fall, and you will have forgotten or you will overlook why you had a problem with her, and you won't get rid of her, and you'll have a problem again the next year. So going back and looking at, why they're on the cull list, but those red tags, or I usually use red because it's kind of a flag that says there was a problem with this ewe at lambing time. Maybe I need to go back and look what it was. And maybe it doesn't justify culling her at that point. You can take the tag out. Or maybe you go, oh, yeah, I remember. She had 3 babies and she only raised one of them. And I fed the other 2. And also, as much as I think producers need to be able to post-mortem their own neonates, don't be afraid to consult with your veterinarian if you're doing these and you'll get some that you go, I just don't know what's wrong. Maybe that's where a little further testing, or obviously consulting with your veterinarian with abortions. My clients, I tell them, when you get an abortion, send me a text, send me an email, call me and tell me you've had an abortion. So then at least I have a heads up that if you get 2 more and I'm suddenly going to have to be able to ship a bunch of stuff to the lab, we're not in the middle of a long weekend. That I kind of have a heads up knowing that there's something could be going on there. So having that working relationship with your veterinarian, and what I normally do for a lot of my producers is if they've never done the lamb autopsies before or postmortems, is I say, okay, well, when you get a dead one, regardless of whether you know why it died or not, let me know. Even if they save it, they keep it cold for a day or whatever, and then let's do the postmortem together. That way they can learn proper technique. I can point out things. They can ask questions about, which organs are which. Then they can go forward from there. And I think, a lot of local veterinarians, I mean, some people might balk at that, but if you don't learn to do them and be comfortable triaging some of the really common stuff, then they're not going to get done at all. Because for sure, nobody's going to pay me $150 for a dead day-old lamb to decide why it died. So I think that's kind of an important part of this. I have given you a second handout called Lamb Autopsy. This was actually put together for producers in Australia by the Australian Meat and Something group. So it actually is kind of nice too. It's got nice pictures, and it goes through, again, how to go through the steps of doing the postmortem, and it has a little bit different checklist that you could also use as a recording form if you want to. So it's just a couple of different articles giving you the same type of information, but presented slightly differently. So it's a little bit easier. So everybody learns differently or sees something that suddenly clicks for them. So I've given you a couple of different options if you want to try doing this yourself that can kind of help you work through it. And I think we're good, and we can go to questions.
Thanks so much, Lynn. Great presentation. We have a couple questions that have already come in, but again, this is just a reminder of send in your questions. We've got a little bit of time here, so we can definitely answer any questions that you have. But I'll just start at the top here and work our way through the questions that have already come in. So I've got lambs or kids born with a bag over their head. What are the reasons for that?
There can be a variety of things. Top of the list is sometimes the placenta is just a little thicker, and for whatever reason, as the lamb's being pushed out, it doesn't break. Or it does break, but it's just the way the lamb or the kid lands on the ground, that it lands on top of them, and it's heavy and it's wet compared to them. I think it's one of those things that you really can't change the management of, and you have to accept that sometimes, unless you're going to be standing there 24/7, you just have to accept that occasionally these things happen. I've had it happen to me. You find them and think, if I'd been here 10 minutes ago, this lamb would be alive. But nobody's ever sort of determined that, it's a nutritional thing. It's one of those things that just occasionally happens.
Okay, thanks. Second question. I think you touched on it maybe a little bit, but do you advocate for the use of Lamb Quick Start? And if so, where do you get it?
Quick Start. I can't say I advocate for it because that's a new one for me. So I guess it depends what exactly is in it. I do advocate for the use of artificial colostrum. If you think a lamb needs it or a group of lambs need it, absolutely, you're not going to do them any harm by tubing it into them. As far as, a lot of the supplement, injectable, oral drenchy things, I really think unless you actually have something like a clinical problem with selenium deficiency, where a lamb truly needs selenium and you give the injectable form, I think a lot of those things that are done are not really required, and a good portion of them really don't make any difference if you just get quality food into them. If you get your nutrition right on the ewes, then the lambs will take care of themselves.
Okay, thanks. And if ewe colostrum is not available, can cow or goat be substituted?
It can. You do need to be concerned with diseases. If you have goats within your own flock, like if you have sheep and goats, and you want to go use one or the other across those species, I think that's fine. Cow colostrum, you have to be very careful about Johne's disease because it can be transmitted in the milk. So unless you know that it's a Johne's free Johne's-free herd. The other thing is the most easily accessed natural colostrum is from Holsteins, except Holsteins are selected for quantity, not for quality, and their colostrum is not actually that great. It's okay colostrum, even if you're a dairy calf. It's not great colostrum for lambs or kids. I would much rather, from a health and access standpoint, have you buy a bag of like the Head Start artificial colostrum and use that. The disease control is there. It comes from very specific herds. They're super immunized, so you're getting good levels of antibodies for things like your clostridial diseases, pulpy kidney, that type of thing. I would much rather go with the artificial stuff. But yeah, if you're in a bind and you don't have that option, sort of any colostrum is better than no colostrum.
Okay, great. What's the easiest way to get the perineum to stretch so that you can get the lambs out?
Generally gentle pressure. If you're starting to pull them out, usually the part that sticks on a normal presentation lamb is the forehead. And so what I will often do is, and this happens in cattle too, but if you have one person gently putting pressure on the lamb, pulling the lamb, and you've got some lube, you've got it lubed up, get the other person to actually tuck their fingers around the top of the perineum and just kind of see if they can't just gently keep putting pressure on it and stretch it back and pop it over the forehead. Once you clear over the forehead, typically after that, it's not a problem.
Okay. One question here about frozen colostrum.
Frozen colostrum is fine, and I guess in the perfect world, frozen colostrum that's come from your own sheep, maybe you have a few ewes that are very heavy milkers, or what some people will do is if ewe only has a single, they'll let the single nurse one side, they'll milk colostrum from the other side, freeze it. It shouldn't be frozen and thawed repeatedly, so a lot of people will freeze it in either small yogurt cups or in ice cube trays, so that then when you go to use it, you can just thaw the amount that you want. It should be kept well frozen, preferably a deep freeze versus like the little freezer over top of your fridge, like an actual chest freezer. And generally speaking, they feel the quality is maintained probably for a good year. So you could, if it stays properly frozen, carry it from one spring or one lambing period to the next. So yeah, that would be the perfect solution. But for a lot of people, it's not as accessible. They just don't have enough that they can get it off their own animals.
Okay, when should you give Baycox?
That depends on when you think your risk for coccidiosis is going to be. So if I'll give you an example. So for somebody who lambs in the first 2 weeks in January, like myself, we don't see coccidia in lambs in January, February, even usually into March, early March, because it's too cold. I mean, unless they're actually locked into a heated barn, it's typically too cold for the coccidia really to be infective, and the ground is frozen, so the lambs aren't, they're not grazing, they're not drinking out of little puddles and sloughs, and so the exposure for those lambs is really low. However, those lambs at, say, weaning time in March, now their risk for coccidia may actually go up, because now they're probably going to be out, it's starting to melt, it gets muddy, they drink out of puddles. So those lambs, I would typically recommend giving them the Baycox, say at about weaning time. Baycox gives you about 40 days of protection. And what it does is it doesn't eliminate the coccidia, it allows the lambs to be exposed, but at low levels. It keeps it at a very low level. So that means they don't get sick from it, but it gives them enough exposure to build the natural immunity that you want. Now, lambs that are born in March and April, a lot of those producers are going to give Baycox to lambs that are maybe 2 or 3 days old, because that first 30 days of life, they're at risk already. and the incubation period is about 17, 18 days. So you could have 3-week-old lambs with clinical coccidiosis if you have the right environmental factors. So they'll often give it then, and then they'll have creep feed that has decox in it. And by the time the baycox starts to wear off at about 40 days, they should be eating enough creep feed for the creep feed to take over and carry them. So how you use it and when you use it really depends a lot on the timing of your lambing and what type of management your animals are in as far as confinement and exposure. So that it's really something I think that you need to work with a veterinarian to work out what is the best timing and is going to have the best effects for you in your operation. There's no sort of one clear-cut answer. But it is an awesome drug. I'm so glad we have it.
Okay, with prolific sheep like Romanov, can you keep the 5 babies with the ewe for 24 to 48 hours if you ensure that they've all nursed and have had adequate colostrum, or should you pull them right away?
That would be a question for Eilina that raises Romanovs. Making, because I'm not exactly sure what she does at her house. I guess there's a couple of different things. Is most of the time, if you have those type of numbers, I think if you want to let them all nurse the ewe initially, that's fine. But consider that you maybe should supplement everybody with a little bit of artificial colostrum. Even the way Head Start works is that if you're going to completely remove an animal and it's not getting any natural colostrum, it gets 3 doses of that over 24 hours or over the first like 18 hours. I recommend that even if they're going to nurse the ewe, give everybody in that litter 1 dose of Head Start so you know for sure everybody's got that much. And then they can nurse. It depends a little bit on your philosophy. If your philosophy, and I have goat breeders who do this, they will say if I have a set of, say, quads and I have 2 doelings and 2 buck kids, they're going to leave the doelings on the doe and they're going to pull the buck kids and feed them because to them the doelings are the most important. And so they tend to pull them right away and just get them on a bottle and feed them. If you want to take the philosophy where you'll leave the whole group together, give it 24 hours and see which ones are not as competitive for the food and pull them and leave the stronger ones with the ewe, that's completely acceptable too. So sometimes it depends just a little bit for the producer on what works the best for them. I think either's okay for the lambs as long as you're careful not to let anybody starve.
Okay, great. I only have one more question left, so everyone who's still on the line here, if you have a question, this is kind of your last call to get it in. The last question I have as of right now, if you diagnose chlamydia as the abortion cause, what is your approach for the problem?
It depends a little bit, again, on the timing of when we diagnose it. If we get an abortion that's diagnosed as chlamydia and we're, say, still 30 days from when normal lambing should occur, then we certainly can use tetracyclines, either injectable or we can add tetracycline to the feed to basically hopefully prevent further abortions. Because the chlamydia is excreted in the birthing fluids, and so that's where it becomes most contagious. Now, what you also have to realize, though, is that a large amount of chlamydial abortions have been exposed to the chlamydia before you even know that you have a problem. Herds that have a previous history of chlamydia, that know the organisms in their herd, they often feed tetracycline in the feed from breeding time on. I'm not a huge fan of that, but it certainly does keep the problem under control. The one thing that's going to maybe people are going to have to wrap their heads around is in another year, when the new regulations come into place controlling the use of antibiotics in feeds, you will not be able to go to the feed mill and buy feed for your sheep with tetracycline in it without a prescription from your veterinarian. So, you know, now you can just go buy feed with tetracycline in it. It's perfectly legal. That's not going to be available anymore. So there's that to consider. If we get an abortion and we're right at the start of lambing, especially if it's a synchronized group that's going to lamb fairly tight, at that point treating with tetracycline may not make any difference because you're so close. Going on to the future times with the chlamydia, I think any from chlamydia should automatically be culled, but you have to assume that you could have non-clinical shedders in your herd. Then there is a vaccine available. All of these things are not 100%. They're more to sort of manage the clinical disease. Ultimately, it would be nice to eradicate it, which means some pretty brutal culling, and maybe not buy it in, so being very careful about asking those type of questions, and maybe not saying to somebody you're going to buy sheep from, well, have you had any abortions? I mean, they may or may not be honest with you about that, but to sort of just ask questions about their biosecurity, about, you know, where their ewes come from, you know, how many abortions they see in a year. I mean, if you have a flock of 500, you're going to see 1 or 2 that have nothing to do with contagious issues. So again, you know, it's one of those diseases where you really have to, it depends on the timing, depends on how big a problem you think you're going to have or that you've had in the past, and work with a veterinarian to fine-tune what you do in that herd.
Okay, great. Looks like we don't have any more questions, Lynn. So we're done on that part. So I just want to take the chance here to thank you so much for giving this great presentation to us tonight. And we really appreciate your time and in giving us this great information. So thank you so much.
Thank you. Hopefully it's helpful.
Absolutely. And again, a reminder that we've recorded this. It will be on YouTube. And when you exit this webinar, you're going to get a survey that's going to pop up, and we'd really appreciate you filling out the survey. Let us know what you think. Let us know what topics you want, because we would love to hold more webinars. So please do send us your thoughts. We've got lots of great resources on our website. The link is right there, www.ablam.ca. And thanks again for spending your Monday evening with us. If anyone has any other questions, feel free to contact me through email, through the website, and we will get that answered for you. So thanks again, everyone, and have a great evening. Thanks again, Dr. Tait.
Thank you.
Good night.